Come in.
Hi, good afternoon. My name is Fran. I'm a nurse here at Brown University. Hi, are you Mrs. Marie Addison?
I am.
Okay, can I call you Miss Addison or Marie?
Sure. Marie is fine. Marie is
Okay,
fine.
nice to meet you. So I'll be doing your musculoskeletal assessment today. What brings you to the doctor's office today?
Just a general physical exam.
Okay, very good. Now before we get started, I need to ask you a couple of questions, okay?
Okay.
All right, have you had any pain in your joints?
No.
Any stiffness in your joints?
No.
Any swelling or heatness?
No.
Any limitations in movement?
No.
Any muscle pain?
Uh,
Any deformities that you notice in your bones or joints?
no.
Okay. Any back pain?
No.
Have you had any activities doing daily activities, like showering, getting out of bed, moving around, maybe cleaning, like cleaning around the house?
Not that I can think of. No.
Okay, very good. Have you suffered any recent trauma, like been in a car accident or fallen and hurting yourself in any kind of way?
No.
Okay, very good. Very, very good. All right. So this part of the assessment, it requires me to have you standing up and do a lot of movement just to make sure that the joints are flexible, that you don't have any pain, and that there are no abnormalities, okay?
Okay.
So I'm going to ask you to move around a lot. If you get tired or anything bothers you or hurts you, let me know. We'll stop or we'll pause, okay?
Okay.
All right, very good. So I'm just going to go over here and wash my hands. Okay. All right. So now the first thing I'm going to be inspecting is the spine and actually the contour of the spine. I'm just going to look this way. You stand, you had it straight. Very good. From noticing, just looking at her, the spine is erect and it's straight. The head is straight. There's no obvious signs of neural defects, which would show the head bobbling or anything. Nothing of that nature going on. It's straight and in line. The temperature of the skin, just going to touch you, is consistent with the rest of her body. Does it hurt when I touch you?
No.
Okay, good. There's no pain or swelling noted. Now what I'm going to do right now, I'm going to be testing the integrity of your spinal nerve, number 11, which is going to have you moving your head and stuff around.
Okay.
Okay? So now I'm going to ask you to flex your neck, which means to fold your neck back. Fold your neck. Okay. Good, very good. Did you have any pain while you did that?
None.
Very good. Now do me a favor, if you could look to your left for me, and your right. Very good. Okay. Now that's checking the spinal nerve, number 11. So she has full range of motion. There was no pain upon movement. I didn't notice any crepitus while I had my hand at the base of her neck while she was moving around. Now I'm going to, right now I'm going to be checking the shoulders. I'm going to check them anteriorly and posteriorly. You know what's going to be a better thing for me? If you could please sit here in this chair for me.
Sure.
Very good. That way I can have a look at you from the front and the back, all right? Okay. So anteriorly, I'm looking for any swelling, any abnormalities. There's none noted. Do you have any pain?
No.
Okay. There's no pain. The skin temperature is consistent with the rest of her body. There are no lumps and bumps and bruises. Okay. I'm noting her landmarks. I see the acromion process is intact. Okay. We have the clavicle bone intact. Does that hurt?
No.
I palpated. Very, very good. Okay. Now I'm going to ask you to do a couple of things for me, okay, Mrs. Addison?
Yes.
Now, I'm going to ask you to raise one hand up straight above your head. Good. And now push it down, all the way down. Very good. Back down to your side, like this. Let it hang on the side.
Okay.
Good. Push it up, one arm up, all the way up again for me. Very good. Now down. Okay, now bring the same arm back as far as you can. Very good. Oh, excellent. Very good. Thank you. Did you have any pain while you were doing that?
No.
Okay. So what I just checked was the flexion and extension of the joint, and it was very, very well. Now what I'm going to ask her to do is the abduction and adduction of the joint. And what I'm asking you to do is take your arm, one arm, and then just bring it across your body like that. Good. Any pain?
No.
Okay, and now out to this side like this. Very good. Any pain?
No.
All right. So I'm going to ask you to do that again against gravity for me. Push. Good. And now lift the arm up. Good, very good. No crepitus noted, no pain. The range of motion is normal and within normal limits. Okay, you okay with me, Miss Marie?
Yes.
Very good. Now I'm going to inspect the elbows. Can I have your elbow, please? So while I support here, very good. This is the olecranon process. Very good. Let me check the other. Bend the elbow. Good. Right there. Okay. Very good. There's no pain, is there, when I touch it?
No.
Okay. No swelling, no lumps noted, no mass. Okay. Now for this one, you're going to have to stand up for me. Okay. What I'm going to be doing now is asking you to flex the elbow. Flex for me.
Flex it back, right?
Okay, good. And extend. Very, very good. Okay, extension. Very good. Now we have pronation, which is going to fold down like that. And supination is like this. Very good. Do you have any pain when that happens?
No.
Now do the same thing with the other arm for me. Same thing. Flex and extend. Good. Now, down for pronation. Okay, and supination. Very good. Any pain?
No.
Okay, movements are equal bilaterally on both sides of the arm. There is no crepitus noted, no pain. Okay? So now we're going to check the wrists. Right? How's your wrist feel? You have any pain? All right. Now, what I'm going to ask you to do is hold your wrists like this together, just with slight pressure. Do you feel any numbness?
No.
Okay, very good. Now, what that test is called is a Fellaini test, and what that test is to see if you have any history with carpal tunnel. Usually, if you had it, it would cause numbness in the wrist area. You don't have it, so which means that it's probably a good thing that you don't have carpal tunnel, right? So now we're going to check the expansion and flexion of the wrist. Okay. So now what we have, the radial it's here and the ulnar here. Now if you just open your fingers wide for me. Very good. And close them back up. Now take your thumb and touch each finger. Very good. Same with the other arm. Good. Very, very good. Was there any pain?
Okay.
Okay, now we're going to flex the wrist again. Very good. Same thing with the other wrist. Good. Any pain?
Okay.
Very good. All right, so the wrists then are intact bilaterally with no pain or crepitus noted. Right now we're going to check the hips. We'll check the hips bilaterally, and what I'm looking for right now in inspection is that they're equal bilateral. There's no deviation. There's no one hip higher than the other. There's no swelling noted. Do you feel any pain when I palpate?
No.
Very, very good. Now, Marie, I'm going to ask you to do one thing for me. If you can just bring your knee up like this. Very good. And down. Good. Up and down. Good. Any pain?
No pain.
No, that popping was my knee. Yeah, I'm getting old. Sorry. Now, what I'm going to, okay. So no pain, no crepitus noted. All right, do me a favor, Miss Marie. Have a seat. Now, what I'm checking for is the knees. I'm going to check, I'm palpating here. We start just a couple of centimeters above the knee. We're checking for fluid, any excess fluid. Does that, you have any pain or anything? Good, all right. So there's no excess fluid noted upon palpation. They're equally bilateral. There's no swelling, no masses. All right, so your knees, can you flex your leg out for me? Good, and the next one? Beautiful, very, very good. Okay, so now we're checking the ankles bilaterally. Do you have any pain? Okay, there's no pitting edema. Always check for peripheral pulses. They're equal bilaterally. Very good. Equal bilateral peripheral pulses, which is very good. Cap refill is brisk. Skin is warm and intact. All right, very good. So now I'm going to ask you to do dorsiflexion and plantar flexion. Now, dorsiflexion, you just fold your feet up. Good. Any pain?
No pain.
Okay, plantar is down. Any pain?
No.
Good. Any pain?
No.
Good. Okay, very good. And at those, you did the right angle. Usually with dorsiflexion, it's 20 degrees, and plantar is 45 degrees, and you have that very, very well. Now I'm going to ask you to do what they call inversion and exversion. Just swing your feet in like that, and then twist them out. Good. Any pain?
No.
One more time for me. Good. All right, Miss Marie. Very, very good. All right, so that concludes the yes, the ankle part of the inspection. If you can stand up for me, please. Okay. So now I'm just going to take a look at your spine. What I'm looking for is make sure that the spine is straight and intact, which it is. There's no kyphosis, which is what would be located here. No lordosis, which is usually pregnant women or very obese people with a lot of weight in their midsection has that. You don't have that, so that's very, very good. Okay. What I'm looking for also, if you can put your arms down, the space between the arms and the lateral aspect of the body, which is equal bilaterally, and that's good. That's what we're looking for also, okay? So now I'm going to ask you to just bend over for me. Bend. Good. That's a perfect C shape is what we look for. Do you feel any pain or anything?
No.
Okay, very good. Stand up for me. All right, so the cervical spine is concave. The lumbar spine is concave, I'm sorry. And the thoracic spine is convex. Very, very good. Okay. Now, so I'm going to ask you to just rotate, just twist for me to the left. Twist your body at the hip. Good. To the left and again to the right. Any pain?
No.
Very good. All right, Miss Marie, is there any questions you have for me? Okay, so I'm going to ask you if you can just walk towards the window for me, please. Good. And back? Good. Okay. The gait is steady. Arms swing freely at the sides bilaterally. I don't see any abnormalities. Did you feel anything differently when you were walking, Miss Marie?
No.
Okay, very, very good. Okay, that concludes the part of our musculoskeletal assessment. Thank you so much for participating, okay?